Low back pain is the most common musculoskeletal complaint for someone seeing a doctor, and it is increasing despite all medical advances. It's also the #1 cause of disability worldwide. Hey everyone, Dr. Zach Greenwood here at Performance Sport and Spine, and today's video will discuss all things back pain. Now this is something that almost everyone deals with at some point in their lives, so we'll discuss things from exercise to causes. We'd really appreciate at this point if you pause the video, like and subscribe to our channel, turn on the notifications to make sure to stay up to date with the latest content. Low back pain is a symptom, not a cause or an illness, and there's many different reasons that your back can hurt. Low back pain is defined as any pain that's from the inferior margins of your ribs down to the creases of your buttocks, and it may or may not be accompanied with leg pain. So 1 to 2% of all back pain is caused by serious specific pathology, such as fractures, infections, or tumors, and these always require immediate medical attention. So the next group is about 5 to 10% of all low back pain individuals. Now these people have either radicular pain or lumbar stenosis. So radicular pain is something either compressing or inflaming the nerve root, which is most likely a disc irritation. And stenosis is where the central canal of the spine is closing off, causing irritation to the spinal cord. Now important to note that both of these cases, there will always be leg pain and or loss of function in the lower extremities. And the final group, which encompasses about 85% of all low back pain, is non-specific low back pain, which means that no single tissue can be identified as a pain generator. Another term for this is mechanical low back pain. It's well documented that musculoskeletal pain, including low back pain, has a biomechanical, psychological, and social aspect to it. With this kind of back pain, the pain can be so intense and the quality can be so scary that people can't help but think that their back is damaged. So it's important to find a medical practitioner that can reassure you that this pain is more about hurt, tissue sensitivity, than damage. So one important thing to note, this last group of back pain patients, the non-specific low back pain, routine imaging is not recommended, and there's several reasons why. So the first reason is, if you can see from this chart, people in their 40s, 50% of people had a disc bulge and they had no pain at all. No leg pain, no back pain. Now, some of these abnormalities do increase with people in pain, but it gets murky quick, and we'll discuss this more in a different video. Another 2 reasons is that these routine imagings have not been found to increase clinical outcomes, and often they don't change management, so we don't do a test if it's not going to change what we do in terms of advice and exercise. So how common is low back pain? 40% of 8 to 19-year-olds will experience back pain at some point, and back pain actually peaks in prevalence in the mid-50s. Now, one thing to note is back pain-related disability actually gets worse as people get older. So regarding adults, 80% of people plus will experience back pain at some point in their life, and most cases get better within 4 to 6 weeks. So 1/3 of people will still experience pain at 3 to 12 months. And unfortunately, if people have experienced back pain for more than 1 year, it's very unlikely that they'll ever fully resolve. Back pain has been found to be more common in the morning, but not more common with cold weather, and this is likely due to recall bias. So there are several important risk factors for low back pain, such as previous episode of back pain, heavy manual jobs, obesity, smoking, poor general health, and poor mental health. So now we're going to talk about treatments, but it's really important that we shift the narrative from treatments to management. We're not fixing a specific structure or tissue, we're helping managing people and help decreasing disability related to pain. Now this is assuming that we're dealing with just non-specific low back pain and a trained healthcare provider has ruled out anything more serious. So first line treatments that have evidence is the advice to remain active to the individual, exercise and education, trying to maintain social interactions and daily activity, and then cognitive or psychological treatments. So treatments that have little to no evidence is bed rest, back belts, shoe insoles, and ergonomic programs. So second line treatments that do have some evidence are spinal manipulation, massage, and acupuncture, but again, it's important to note that these have to be augmented with the first line treatments. They can't be standalone. Oral NSAIDs and Tylenol can be used, but it's the minimum effective dose for the least amount of time. Corticosteroid injection shots and opiates for most people are not recommended. So lastly, we're going to go over some great options that you can use for exercises. Now these should always be tailored to the person's needs, preferences, and capabilities. So the first exercise is just kind of how to change how you move. And so a lot of times with this pain, it's so severe and so intense that you kind of want to hold your breath or tense your whole body before you move. So sometimes when you go to stand up, you'll feel yourself hold your breath, tense, and just kind of brute force try to stand up. But what can often help a lot of people is relaxing, decreasing all that bracing and guarding, maybe using your hands and try to gently just stand up with your legs, trying to relax the back. Now this can be applicable to rolling over in bed or picking things up. Again, trying to do a less threat or less stressful movement often helps with pain. So the first exercise is the cat camel, where you're going to arch or extend your back and then round your back to tolerance. Now you may find that one area moves a lot and other adjacent areas don't move as much, so it may help to try to focus more on squeezing your butt and moving your lower back, or trying to emphasize the upper back a little bit to see what feels the best. To explain this a little bit farther, let's say you're doing the cat camel and most of the motion is coming from your upper lumbar spine. It may be helpful to kind of focus on moving your lower back a little bit, the lower lumbar, or more up in the thoracic area to kind of see what feels the best. Another good option is just a gentle rock back. Now, when you're doing this, it's important that you don't want to guard or kind of brace your core. You're just kind of moving back to tolerance, and don't think of it as a stretch, but kind of each sequential rock back, you're trying to go a little bit farther. Now, the pain should never increase in any of these movements. Marching can be helpful drill exercise, as when you move your leg up, you help bend your spine. So again, you can stand and just kind of hit your hands as you march. Now, if it hurts too much, you can go a little less high, or to increase the difficulty, try to reach really high. Because as you can see, as I lift my leg up, my back bends. So it's a way to kind of introduce movement into the low back. Another type of exercise is rotation. So laying on your back with your knees bent, using your arms as kind of guides, you can kind of rotate through your back and hips, your legs side to side, using your arms as a kind of a safety net to help make the movement feel a little more relaxed. And again, it's not a stretch, you're just trying to move to tolerance, and you may find that as you go through each rep, you can go a little bit farther. And again, the pain should never really increase during these. Another exercise is the tail wag. So you're just going to be on your hands and knees and just kind of let your hips fall to one side and then the other. And again, there can be some discomfort, but it should never increase, and it's never a stretch at end range. You're just kind of moving to tolerance and trying to increase range of motion over time. Sometimes it may help to bring your knees a little bit closer to your hands. That's often a little less threatening, a little easier. Or if you want to make it a little more challenging, maybe go farther away. Again, this has to be tailored to the person and to your current level of pain. So the next exercise is just kind of using like a ball to kind of help strengthen the muscles. So we're going to press our hands down into our legs. And again, variability is so important with dealing with back pain. So maybe you want to press with just your right arm or just your left arm. And you may find that the left arm really hurts, but the right arm doesn't hurt as much. So push a little bit harder with the right arm initially, and then gradually add the left arm in on subsequent exercises. So the last thing is just good old-fashioned walking. Now, walking can help with human help, which can help deal with low back pain. So you may only be able to walk for 5 minutes initially, but then maybe the next day you can walk for 8 or 10 minutes, and that's a 100% increase. So this can really help start reintroducing activity and movement into your life. All right, that's it for today. We really hope this helps you with back pain, as it can be such a debilitating and frustrating condition. As always, if you have any specific questions, leave it in the comments below or email us directly. And again, thanks for liking and subscribing.